What if we could predict chronic Lyme disease before it starts? This is a question I commonly get asked. This is part of a Common Sense Lyme series where I address these issues. I'm Dr. Cameron. So let's begin. Now, the problem is that you can have the same diagnosis of Lyme disease, neurologic Lyme disease, but have different outcomes. Some patients recover, others stay sick for years. Right now, we can't really tell that well who's at risk. So why it matters. We need to find out a way to prevent chronic Lyme symptoms, chronic Lyme manifestations, but patients are often dismissed or misdiagnosed so they can suffer for years and it can be more difficult to treat. We treat too late and miss the chances to change the outcome. A possible solution is that AI might have an algorithm that might help spot early warning signs, identify risk patterns from labs, symptoms, and co-infections, and it might help personalize treatment before symptoms become chronic. Although we have to have caution because AI is only as good as the data it learns from. If it pays attention to one set of data, it might say, well, chronic Lyme doesn't exist as a diagnostic entity, it's a syndrome, shouldn't be treated, you shouldn't have to worry about co-infections. Bias and blind spots can lead to Lyme. So ILADS, which I'm a member of, focuses on clinical judgment, shared decision making, that the tests and treatments are not as reliable as we would like, and the treatment has to be individualized. There's no one size fits all, but we need to support if we use AI, but not replace clinical judgment. So what if we could predict chronic manifestation of Lyme? We might be able to begin earlier treatment. We'd have fewer misdiagnoses or delayed diagnoses. There'd be less suffering as we would wait for Lyme disease to be diagnosed and treated. And in the future, we may find a time where chronic Lyme is the exception, not the rule. Thank you for joining me for this Common Sense Lyme series. Appreciate you joining me. Have a good day.